Here's what you will need. A clean disposable plastic bag that will be able to cover your entire dressing site. Prepare 4 pieces of micropore tape to cover all 4 edges and ensure it is completely sealed. Place a towel over the clean disposable plastic bag. For extra protection, use a waterproof dressing under the plastic bag. Now you're ready to shower, but just remember to wash only from the nipple line down.
How about my hair?
You can wash your hair daily, but it's best to do it before your dialysis. And here's how you can do it safely. First, you have to sit down while you wash your hair. Second, you will need to tilt your head away from your catheter side. Third, gently wash it to avoid splashing.
Heng lucky I can still wash my hair. My stitches, where will it be removed?
The stitches will be removed 3 weeks after the catheter has been inserted. 2 stitches will be removed first, over your neck and exit side.
Will you do it in the ward?
If you are still admitted, the ward nurses or the dialysis center nurses will help you remove it.
If I'm discharged?
We will issue you a memo so that the dialysis center nurses can help you remove when the time comes.
Okay, got it. What if the dressing still gets wet?
If your dialysis catheter becomes wet or loose, you will need to change it immediately to prevent infection. To change your dressing, you can visit your dialysis center on your dialysis day or see a GP on your non-dialysis day. But if you have a home care kit, you can change it yourself.
Home care kit? That's interesting. Where do I get that?
You can purchase it from our SKH Pharmacare upon your discharge.
What is inside the home care kit?
Let me show you the content and how you can change your dressing using the home care kit. This is what is in your home care kit. Some additional items that you will need. Ensure all items are not expired. Step 1. Prepare your supplies. Gather and open all the items required for the dressing change. Prepare 2 micropore tapes to secure the catheter tubes. Do the 7 steps of hand hygiene by washing your hands thoroughly with soap and water or with an antiseptic hand rub. Put on a face mask to reduce the risk of infection. Step 2. Remove the old dressing. Gently peel off the old dressing while holding the catheter in place to avoid tugging. Check for redness, swelling, pus, leaks, cracks or dislodgement of the catheter. Step 3. Perform hand rub and clean the exit site. Take a Chloroprep or Povidone iodine soap stick and clean the exit site in a circular motion, moving from inside to out. Repeat this for the remaining soap sticks and let it air dry for 30 seconds. Do not touch or blow on the site after cleaning. Step 4. Apply gentamicin cream. Squeeze a small amount of gentamicin cream on the sterile gauze to apply on the exit site. Step 5. Secure the new dressing. Place the outside waterproof dressing over the exit site, ensuring that the catheter lies flat. Wrap both tubes with 2 pieces of gauze and secure it with a micropore tape. Add a second piece of micropore tape onto the chest for extra security.
I get it now, but how do I know if there's an infection?
Good question. You need to look out for the key infection signs such as fever above 38 degrees Celsius, severe pain, and foul-smelling discharge from your catheter site.
Is there anything I can do to protect my catheter?
To protect your catheter from damage, first, do not sleep on your catheter site. Second, do not wear any jewelry that entangles around your catheter site. Third, do not carry children as it can cause accidental pulling or dislodgement. Fourth, keep sharp objects away from your catheter. And fifth, keep your pets away to avoid contamination. In addition, you need to take note of these warning signs. First, if the catheter gets dislodged, do not attempt to push the catheter in. Second, if you notice active bleeding, apply firm pressure using a clean towel. Third, look for signs of infection. And fourth, if you experience any chest pain or difficulty breathing. If you experience any of these warning signs, please proceed to the emergency department immediately.